In the third presentation we have in this ASCO as pertains to MDS, we looked at the issue of the oral decitabine/cedazuridine, which is an oral version of oral decitabine. And this was a real-life analysis focusing on the question of what we call time toxicity. What does time toxicity means? That patients who have incurable cancers, with most of MDS patients will have an incurable cancer, except the small minority who go to transplant, are spending a significant amount of their remaining life in the hospital, in the emergency room, in the clinics, getting infusion, getting blood transfusion, etc. And that is, this impacts their quality of life, and certainly what we refer to as time toxicity, because most patients prefer to spend it with their families, out of the hospital, etc. So we wanted to compare between the oral version of decitabine and the IV and injectable version of decitabine, as well as azacitidine. And clearly here what we found, I think as someone would expect, that there was a significant reduction in the amount that's needed to be spent in the hospital and in the clinic with the oral version, almost half of the time that was needed as compared to the parenteral formulations, the hypomethylating agents. So in my mind, that adds to the kind of real life data to the notion that the use of oral hypomethylating agents is better from a patient experience, in addition to having equal efficacy. So I do think for most patients who receive HMAs, the use of oral decitabine-cedazuridine is a very reasonable option.